Cold and flu season is here, and with it, a spike in doctor visits and antibiotic prescriptions. But did you know that up to 30% of those prescriptions are unnecessary? As AMR Awareness Week approaches, health experts are sounding the alarm about antibiotic overuse and the growing threat of antimicrobial resistance, or AMR, which already causes millions of infections and tens of thousands of deaths each year in the US. Now, joining us to talk about what's driving this crisis and how diagnostic testing can help you protect yourself and ensure antibiotics are used only when truly needed is John Hurst, Farmer D, Senior Director, Field Medical Affairs at bioMérieux. Good morning, John. How are you?
I'm well. How are you?
I'm doing great. What exactly is antimicrobial resistance and how does it happen?
Yeah, antimicrobial resistance is when bacteria learn to resist the antibiotics that are designed to kill them. And that can lead to infections that don't immediately get better and might be difficult to treat or even impossible. And a lot of this is driven by the overuse and misuse of antibiotics.
Now, how does this resistance impacting patient care here in the US? And what are the risks if we don't act now?
Yeah. Antibiotics are a miracle of modern medicine. They are what allows us to treat patients with cancer. They allow us to transplant organs. They allow us to replace heart valves. They are essential to safe procedures and treatments of really sick patients in the US and the globe. And we need to take care of these antibiotics and make sure that we don't overuse them to the point that are ineffective when people have infections or need to be protected against bacteria.
Now, what's being done to help manage this problem?
Yeah, first and foremost is diagnostics. Diagnostics are really the cornerstone of our public health response to AMR. They help prescribers identify exactly which bacteria or virus is making a patient sick. They give it a name and a specific treatment, and can even tell which antibiotics might be effective, or if antibiotics are needed at all. Secondly, is antimicrobial stewardship. This is the teamwork that exists between laboratorians, pharmacists, and prescribers that is dedicated to making sure that we don't overuse these antibiotics. Antibiotics aren't always safe. They have adverse events. There's downsides to antibiotics if you don't need them. They can make them less effective the next time you might actually need them. And lastly is a campaign to really get the word out there. This isn't something that people run into in their daily lives and conversation. And so with World Antibiotic Awareness Week, bioMérieux is making a statement on this topic. And we've partnered with 14 centers of excellence around the world. We call these antimicrobial stewardship centers of excellence. These are hospitals that have demonstrated excellence in diagnostics. And so we're working with them and connecting their expertise and helping others learn how to take care of antibiotics.
John, can you share how innovative diagnostic technologies are helping your team identify infections faster and use antibiotics more wisely?
Yeah, absolutely. When I started, I was at the hospital and we would have a patient who's really sick with a condition called sepsis, and it's overwhelming kind of bacterial infection, and it makes your immune system go haywire. But when we originally started, we'd take 2.5 to 5 days to figure out exactly what that pathogen was, what that bug that was making them sick was, and what antibiotics were the right ones to treat them. Now that technology takes about an hour after we have a positive blood culture, and we can actually know exactly what that bug is and how to treat it. And this greatly reduces the amount of antibiotics we have to give these patients that might be totally ineffective because it could have not covered the bug that they actually had. So basically, if we know what we're treating, we do a lot better job. And we now have technology that's brought that much sooner in the patient care episode, as well as in your own doctor's office or urgent care. We have tests that are now down to like 15 minutes to be able to tell you what's going on and what's causing your illness.
John, what's the most important thing you want viewers to remember this cold and flu season?
Yeah, first start with just regular hygiene. Wash your hands, try not to touch your face in public. If you're sick, stay home. Second, if get a vaccine. The flu vaccine is recommended by the CDC for everyone 6 months and older, except for those with extremely rare scenarios, in which case you want to talk to your doctor and make sure you're getting what's right for you. And then lastly is change your perception when you're walking into your physician's office or your urgent care. We don't want people walking in looking for an antibiotic. We want them walking in, looking for an answer. And a diagnostic is the way to do that. If that's right for you, your prescriber can order a diagnostic and you can actually walk out with a diagnosis that might be bacterial or it might be a virus, in which case you might need chicken noodle soup and a nap on the couch rather than an antibiotic that could make things worse and make future infections worse.
I like that chicken soup and a nap. I still remember grandma, get your hot toddy, that hot tea, some honey, and a little bit of rum. I still remember that. John, thank you so much for joining us on Morning Blend.
Thanks for having me, James.